So my background, I did family medicine for about 10 years. And while I was doing family medicine, increasingly saw a lot of patients that had vein problems and became aware of some opportunity to do some training in venous disease. And so I went and looked at that. And I actually spent about 2 more years doing family medicine after that. And it was really amazing how much vein disease I saw once I was aware of the ability to treat it and help patients. And so through that really and good opportunity to go and do some additional training, I decided about 21 years ago to go that path. And it really has been rewarding ever since. The number of vein patients obviously has mushroomed for us. We see a lot of people from a lot of different walks of life and in different areas that really need vein care and haven't been able to get it. So I think it was just that awareness of a need and then the opportunity to treat and really help people that drew me to it. Yeah, CVR, I think it's a perfect time in our practice for that. Our practice has been here for 21 years, about the length of time I've been practicing. I've been in this practice for about 15 years. And we're two doctors with a nurse practitioner. We service a really large area, a lot of patients. But it's a challenging time in medicine. There are a lot of administrative things, other things you have to do, and regulatory things you have to take care of that an organization like CVR is great at, has done a lot of opportunity to be more collaborative, to just work with a larger group, to some degree bringing us in the 21st century on some technology. We've done well with what we have, but sort of learning, evolving that way. I think it's just an opportunity to join with a big group that has a lot of excellence, hopefully that we'll bring a new aspect to. I think it's really my approach to what really is kind of a surgical specialty, a procedural specialty, probably comes from my family medicine background. It's all about the patient, understanding why they're here. We do see patients with a wide range of reasons for coming in. I think far and away, and most commonly, is patients that have leg discomfort, complications of venous disease. Oftentimes, people that have had those issues for many years and no one either recognized it or realized what could be done for it. So I think really just understanding why the patient's here, whether that's a simple cosmetic issue or more commonly a significant medical issue, and then seeing what we can do to diagnose their problem and then to take good care of it. We really pride ourselves on having the best technology, the most up-to-date things, but at the same time, kind of giving a down-home family medicine approach to how the patient feels here and really the care throughout. I've done a ton of venous procedures, been doing this for 20 plus years. And so you just have a lot of experience at all the things that we do. So I think the unique ability to really rarely do we see a patient, we think, gee, we're not going to treat them because we don't think we can accomplish it technically. A lot of complicated patients that have been treated other places are just a little bit worrisome to treat. So I think that confidence and experience is, I guess that's a skill, but certainly something acquired. I particularly enjoy treating the difficult patients. We see a lot of people with ulcers, blood clots, chronic leg pain that have sort of just been told to wear stockings and there's really not much that can be done for you. And we frequently find that there are things we can do for them. And really, I think overall, that's just really a matter of improving the patient's quality of life and helping them feel like there's hope for what they have, even if that is just conservative measures to be sure we're maximizing those and helping it limit the amount that it impacts their day. So I think it's really just improving quality of life would be the biggest thing. But I think first of all, it's usually educating the patient about what they have going on, why they feel the way they feel, what we're listening to, what we see, and then educating them about what we're doing. And most people aren't too excited about, you're going to get rid of some veins, and how's that going to work? Didn't God put those there for a reason? But when we explain to them, we're only getting rid of the ones that are carrying blood the wrong direction, that they're not doing any good, they're causing problems. Most people seem to understand that well. Just try to use pretty simple, but significant ways of describing that. And I think that helping the patient understand what they're experiencing, why they're experiencing, and why it can be better if we treat it, and what might happen if they don't treat it. I think those are all really important things for them to understand. Well, I think that the opportunity to practice medicine is a real special thing. It's an opportunity to help help the patient, educate the patient to really improve their quality of life, and to maximize, their ability to enjoy their life, minimize their health concern, particularly in our special small area of venous disease. And it's, I think, a place where a lot of people have lost hope, and we can give that back to them and can really improve their quality of life. That's probably my favorite thing that we do. I'm a North Carolina boy through and through. I was born in Durham, North Carolina. I grew up in Charlotte. Went to college and medical school at Duke, and then did my residency in family medicine in Greensboro. So those are all within about 150 miles of each other. Both my parents were from North Carolina. And so I've lived and practiced here my whole life. So I've been doing venous disease now for about 21 years. Like I said, I went back and did some special training at that time and been dedicated to that since then. And I think it's been a great choice. You come to forks in the road, and not quite sure how they'll turn out, but I know it's having an impact in family medicine, and I think for sure it can look across. I see some patients, seen some patients in the last week that it's been at least 20 years that I've been following them and managing them, and they're doing well, and so that's a great feeling. Very blessed to be doing this type of treatment. Extremely blessed to be in this practice setting, and really excited about joining CVR to continue that. I would say we really enjoy seeing patients that have venous disorders. We're up to date on all the newest issues and treatments, modalities in venous disease, and your patient will get special individual focused care when they come here, with a real eye towards improving their function and just making their venous disease as minimal as possible. Maybe the most surprising thing for a lot of physicians is that what we do is 80% at least medical, that it's patients that have symptoms, they have problems, they have concerns that haven't been addressed or haven't been recognized or just hadn't been treated fully. And so for the patient with leg pain, leg swelling, certainly varicose veins, chronic wounds, we can almost always help them here or guide them to where they would get help. And it's a remarkable number of people just that we're able to recognize and treat that have whatever reason they haven't had that. So I think we're uniquely positioned to help a lot of patients that need it, that haven't gotten it. I think for the patient, it's just that our attitude is going to be to really understand what you need while you're here, and then to really try to meet those needs, and also to help you recognize maybe the parts of it you don't understand, the medical side of venous disease, what the options are for treatment, and we're going to try to always make the treatment plan that fits best for the patient. And we really do everything we can to make that happen logistically, everything from insurance to financials to accommodating the patient for appointment times, to making it a very comfortable place to come. We commonly have patients tell us that, wow, from the front door backward, everybody here is so nice. They seem like they're happy to be here. It's not like that most places I go to get my medical care. I really appreciate it. I don't mind coming here. I don't really like needles, but this is a place that overall I feel good when I come, and the spirit and the vibe here is good and positive. And I think that's it really helps us, I think, be able to help the patient and help them through. Nobody likes having medical treatment or procedures done necessarily, but if we can help them see what the positive outcome is going to be, what the difference is going to be, what the risk might be if they don't do it, that it can really help them get through that process.